let me just go back a step.
Yeah.
Because I wanted to ask you, do you think your undergraduate experience prepared you for independent practice?
No.
What is going on, and why is this recruitment crisis occurred? And why is it that people don't want to work these NHS jobs anymore? Why is it that everybody wants to do composite bonding and sexy dentistry, but the skill set isn't there, and the fear of litigation is there, but still they want to do the complex stuff? What is it? What is that?
Instant gratification comes to mind.
Wow.
I feel like we're in a generation where we want something, we want it now.
Okay.
Behind that one post that they've done, you don't see the 100 failures that's happened before that.
Exactly.
And for me, that stuck with me as like, how many cases has it taken them to get to a good case like that?
Whereas I tend to find that, again, talk to young people, that is where they want to go. They don't want to do the routine care stuff. They don't want to be the general dentist. They want to be the cosmetic dentist. And naturally, that is actually, riskier, is it not?
Yeah. Anybody who says NHS dentistry is attractive at the moment, come and speak to me. I lost my father a year and a half ago, so it made me realise that the perspective and everything like that, really putting things into perspective for me about what really matters. Working 6 days a week. I still make money. If you work well and you work effectively, you can make as much money doing 4 days as you can do in 5 days. I need the mental space to do real things. I need to be able to enjoy life.
Hi everyone, welcome to another episode of Dentistry Unmasked. Today my guest is Imaan Khalid, who is a dentist local to me here in Leeds, and she has an interesting story about her undergraduate experience. So she qualified during all the lockdown restrictions, so teaching was moved online, and that continued during her foundation training, and she feels that didn't really adequately prepare her for general practice, which is a story common to many young dentists that I talk to. So have a listen. It's also discussed in this episode about how bodies such as the BACD and associations which are very similar are now really, really important to our young dentists, because it really helps them get that clinical grounding which they feel they're not actually getting now at undergraduate level, which is really interesting. So have a good listen. Your likes, your comments and your shares are always much appreciated, and I'd just like to remind you all that a like and a comment on this video or this podcast if you're listening on Apple or Spotify, and a comment and a share would make you eligible for winning a free vertical preparation kit, which is kindly supplied to us by Former Dental Supplies. So guys, have a listen. I always appreciate your viewing and your listens and your comments and your feedback, so much appreciated. Hope you enjoy the episode.
Imaan, thank you for coming onto the podcast to have a chat with us today.
Thank you for having me.
Absolutely. Well, thanks for taking the time to come and talk to us. Me. Thanks for taking the time to come onto the show. So, I've talked to a few guests up till now, and the reason why I'm doing this is because there is, I feel, a difference in attitude across the generations. So, I mean, we have older dentists who look at the younger generation, such as people like yourself, who are just like, why can't they just do what we do? Why can't they just do, 30 patients a day? Why do they need more time for checkups? Like what we were talking about, before we jumped into the studio.
Yeah.
Whereas there's a lot of younger dentists which are just like, I don't want to work like that. That isn't the dentistry that I want to do. This is, the things that people do, such as amalgams, checkups, etc., etc. I don't want to do that. I want to do cosmetic dentistry. So there's a bit of a disconnect there. So the whole point of this podcast is try to really bury down deep and understand the issues that nobody really wants to talk about, or if they are talking about it, the message isn't really getting out there. So thank you for coming on today. And I really want to kind of dig down into what a young dentist experience is now. Yeah. Because, for me, I've had 20 years of experience.
God, it's been that long.
Yes, I'm a dinosaur now. I'm officially a dinosaur. But, to you, this is just dentistry. This is how dentistry used to be. So what is the dental world today? What is the undergraduate experience like today? What is the world that you are coming out to work into today? So please, let's start with your undergrad experience first of all. So where did you qualify for?
So I qualified in Leeds in 2020. So I was in the COVID era. That's the year of COVID, basically, class of 2020. Basically, that's where I graduated.
Mm-hmm.
Undergraduate experience, up until probably 2019, everything was fine, plain sailing. I think there was always an aspect where there was always, we were known that we had less totals than previous years and the 10 years prior to that, this, that and the other. Even just speaking to clinical tutors and stuff like that, like back in the day we had to do X, Y, Z, and now it's only like half that or even less than that in some cases.
Yeah.
But I feel like I just missed the cohort which had it even worse for than myself. I feel like the people who are just coming out of dental school at the moment is probably the worst affected by the COVID, even more so than just having totals reduced over
The people
years.
coming out now, and you feel that's because...
So because of COVID, a lot of clinics were essentially reduced to the amount of capacity that people were allowed
Of course.
in, and also just the amount of totals that people generally, the number of totals have been reducing over the years, but I feel like the number of students coming in is more, so maybe that's the reason why, it is to facilitate more students coming through. But I think that the COVID era made it worse for them students because your totals were less, patients were not coming in, patients were cancelling as well. So I did a joint dental foundation core training after I graduated. So that's 1 week in hospital and 1 week in foundation practice over 2 years, and I finished that in August 2022. And so for me, I was still in the dental hospital, so I was still seeing, and people's patients were cancelling or they needed longer to do stuff because they didn't have that much clinical exposure. A lot of the teaching was online. They weren't allowed to get the clinical lab experience wasn't as much as it used to be when I was there, because obviously COVID, and there was a lot of virtual teaching essentially. So it means that less hands-on for them, so less competencies for them as well.
Yeah. Wow. Okay. Well, let me just give you a comparison because, as I told you, I'm 20 years qualified, and I qualified from GKT. It was the second year. My year was the second year where Kings and Guys had merged. So, GKT was a new thing when I was an undergrad. And I remember when I was doing VT, I remember my trainer saying to me that I had such little experience at undergrad level. Such little experience because my trainer had to do 60 surfaces of amalgams, 60 surfaces or 30 surfaces of composite, 100 odd extractions, whatever. I had to do something like 30 extractions. I had to do something like maybe 15 plastic fillings. I had to do maybe 10 root canals. We had to do a minimum of 10 surgical sedations over a 2-year period in 4th and 5th year. And, looking back now, that's actually not a bad experience, is it?
Oh yeah, compared to myself, I think we didn't have to do a surgical, for example. That's something I only picked up when I did FD and then did my MaxFax joint dental foundation core training. Alongside that, that's where I picked up my surgical experience. We were able to watch one as a dental student, but we weren't really able to do it.
Yeah.
Other things is like obviously your extractions totals. I think it was 25 when I was there. I think it's less now for students. Root canal wise, I think it was 5 to 7 canals, not even teeth. So, and for example, for my year, if it didn't meet the total, they looked at what you did in clinical skills lab, and if they could count that as towards it. And I think in some cases it was considered to be able to be counted if they had all the tick boxes checked for it. That's not a real life scenario. You don't have the patient, you don't have the rubber dam, you don't have this, that, X, Y, and Z.
Yeah.
So it's a completely different experience to what you'd get in real life, where you're trying to put a rubber dam on. The patient said they can't breathe, can't swallow, this, that, and the other. So there's a lot of differences between that. And I remember there's once that I was going to do a root canal. The tooth had silver points in the tooth, so I needed the help of the endo specialist, and found a fracture. And I was like, can I just fill the canals and then extract it afterwards because I need to get these totals? That's how much I was like. Obviously, we couldn't do that, but I was just like, I just need these totals, and it's really difficult to try and get the totals as it is, and obviously you have to try and get the patient dentally fit as well at the same time. And if patients look quite long appointments, it's a lot of commitment as well. So sometimes you can ask the patient to be there for 3 hours, and it's not feasible for some people. I don't know if it was the same when it was back in your day, but I think people have got more commitments, and dental health is not considered as important. I don't know.
I think that's always been a problem. Well, not a problem as such. That is just the nature of seeing an undergraduate dental student in a dental hospital. I suppose Question for you. How many sessions a week would you spend then in your clinical year seeing patients?
So we're quite lucky at Leeds. Like I said, for myself, we started seeing patients at the end of first year, just perio patients. Just started off with scales and stuff like that. Started off with a bit of not root canal, RSD basically. Started off with a couple of those, and then by second year able to do like small basic fillings, and then after that we were able to build up to slightly more complex and root canals probably by third year. And then fourth year you're probably looking at like your cases, so a mixture of stuff. So your dentures would be third to fourth year as well.
Yeah.
So a bit of mixture of stuff over the years. Clinical, so I think priority was always given to high years, so I think they had the most clinical experiences. So you always assisted somebody as well in your year, so you wouldn't have a dental nurse, you'd assist for each other, and that was supposed to aid you with learning, I guess,
Right.
watching somebody else do it. Whether I did or not, I think that people will argue. For me, I feel like in some experience it did, but in other experiences I was just sat there, suction in hand,
Yeah.
and just sat there for 3 hours suctioning or waiting for the clinical tutor really. So I think like first year maybe 1 or 2 sessions a week. I think by the end of fourth, fifth year, after exams it was a bit more heavier, so it was probably 4 to 5 sessions a week, including an assisted session as well. I included 2 assisted sessions, but it depends on where you were. So you might have a ped session one week and then don't have it the next week, and then vice versa. So you might be on and off with some clinical experience in that respect, because like peds wasn't every week for me, it was every other week. So we only got a session every other week for that, and so you'd swap with the other half of the year to do the other week where you weren't doing that. So you'd have some weeks you'd have slightly more clinical sessions than the week before. So it'd be on and off basically.
Okay. It doesn't to be fair, it doesn't actually sound like you had less clinical time than somebody like me who's 20 years qualified almost. So I'm just trying to work out where this perceived lack of clinical exposure comes from. Because I mean, the thing is, as you know, I used to be a foundation trainer. I was also a longitudinal trainer where my FDs did 1 year 1 week with me in practice and 1 week in hospital. And it was a 2-year training contract. And I noticed a difference. I was saying this to Tony Kilcoyne, who's on the show, a few weeks back. I noticed the difference around the 2015 mark, where dentists were coming out with less I haven't done this before. Or I should say it was more a case of, I haven't done this before. Like one of my FDs did his first root canal with me as an FD.
Wow.
Yeah. And it was just like literally I was showing him how to access a tooth.
Yeah.
I won't tell you where he qualified from, I won't tell you who it is. But in the sense, he was just like, I'd just never done a molar endo before. I've literally done, as you said, in the lounge before we came through. He literally had done 5 canals, 5 incisors, and that was, him signed off as being competent in that procedure. So I'm just trying to work out where this perceived lack of clinical time comes from, because it sounds like to me that you had enough clinical time. But I suppose COVID for you was a big thing, wasn't it?
I think for me, COVID towards the end, because it was like around finals time, but it was literally I think the week or 2 weeks before finals, which all basically don't come back. So like half our cases were unfinished and stuff like that. In respect, it was probably about a week's worth of clinical time in total, without putting all the sessions in together for actual we treating patients, because it was from March that we were not allowed to come back. But I feel like it was, like you said, like 5 canals is not like the same as doing a molar endo. So for me, it's like I hadn't done an access on every single tooth in the mouth, so I wouldn't be able to, like, for me, I wasn't able to say that I've accessed a premolar, an upper and lower premolar, upper and lower molar, and upper and lower incisor, because I hadn't. I'd done 5, 6, maybe 7 canals by that time, and I think one of them was an endo that was on a molar, but apart from that, I think they were either premolars or an incisor or something along those lines. But it's just, and I feel like people now, like coming out of it, I think it's even less because they didn't have the clinical time that we had, so even less so they're seeing patients. I remember me going in when I was doing my longitudinal, my JDFCT, going in and helping a student do an extraction, because I was on my Max Vax clinic. I'd finished my clinic, so I was like, go and help look at the undergrads and 4th year student, and it was only the 2nd tooth they were taking out in 4th year. Wow. So, and they struggled, and like I had to assist, and it wasn't a difficult extraction, but it was just basic things like they hadn't put a full cartridge of
Well, yeah.
LA into this, and I was like, what were you going to do with the other half of the cartridge? Like, just put the whole cartridge in. It was a ID block that given half a cartridge, and it's just stuff like that. I was like, there's only my second tooth that I'm taking out, and it was just like, and a nervous patient as well. So you've got a nervous student, you've got a nervous patient. It's just a bit of a nightmare for everybody in that situation, really. Luckily, I was there to help, but it's. I think it's that fear of doing wrong as well. I feel like that's really drilled into us as a young dentist. I think that's something that's massively, I think, affected me. Is like when I make choices about a patient and I'm trying to do the best for the patient, sometimes I have to think, oh, like, what if it goes wrong? Because it's drilled into you from first year.
That was actually going to be my next question. So
indemnities come in and they to basically say to you,
let's get down to that.
Yeah.
So when was your first kind of like exposure to the indemnity companies?
I think it was first year,
Wow.
first week.
First week of the first year.
I think it was like, you can't have social media, you can't talk about politics, you can't do this, X, Y, and Z.
Right.
There's certain things you can't do. Like, I don't drink, but obviously people do. It's quite a normal thing to do. And it's like, if you get drunk and there's pictures of you, that means you could not qualify this, that, and the other. A teacher got suspended or something for unprofessional behaviour because they were drunk and had a cone on their head or something like that. Somebody had seen that picture. So using examples of other professions as well. So like, you're in a very similar profession, that you have to have this professionalism outside your work capacity as well. So I even just look at, like, you know, what political party it was. You could never post anything about that and stuff they were saying basically to us. So it was very much scares you off from the beginning.
Well, I suppose it kind of makes sense, actually, because social media wasn't a thing until after I'd finished dental school. I remember somebody sending me the very first email around 2004 saying, look, there's this wonderful new thing called Facebook. Let's connect so we can all stay in touch post-uni, you know? So we didn't have any of that. So I suppose, it is necessary to get to you early to tell you about the dangers of all these things. But then that whole thing, I mean, one big thing which I always talk to young dentists like yourself about is that fear of getting sued. Yeah. So, I mean, there's two things there. There's the whole social media side of things, whole social media training. But then where's that thing about getting sued, doing things wrong, you know?
Yeah, so I think that was said to us as well. It was like, you're likely to be sued X, Y, Z amount of times in your career. You should always... There's always that fear in the back of your head. And I feel like as dentists, we're quite a bit of a perfectionist anyways in what we want to do. We want to try and do it to the best of our ability. Well, I feel like I am. I'm pretty sure yourself is, from what I've...
You'd be surprised. You'd be surprised. Yeah, I'm happy to let a lot of things go. Yeah.
I think that comes with age, doesn't it?
When you're a dinosaur like me, yeah.
But I feel like you start off and you always want to do the best, but then there's always that, what if it goes wrong? Like, am I confident enough to do this? Because I've only done X, Y, and Z amount of that times. Like I said, if I've never done a molar, upper molar endo, I've done a lower one. It's your angulation's all going to be different. The way you hold your mirror is going to be different. So it's like, I can do the treatment, but will I do it well? Will it go well? Like, you don't know what the outcome's going to be. And I feel like that. And then there is this whole thing, and like, even on the radio and stuff like that, there's like, have you not be like neglected dental health care, this, that, and the other, about your perio, etc. And that's on the radio. I had to change the radio station over. Things like that are able to just be there. And like, imagine if a patient's in your chair and you're telling them they've got perio for the first time and they've not been diagnosed by it with somebody else prior to you. It's like, I could do that dentist. Did you get the dentist before? It is scary. It is a scary, scary, scary time that we live in. And I feel like it's only going to get worse, if I'm honest. I feel like because so many people are scared of doing stuff, and when they do actually venture out to do it and it doesn't go too well, people are always going to be like, whose fault is it? Well, it's the dentist's fault.
Yeah. You see, it's interesting to hear that, but there is a little bit of a paradox there, because I find, again, that, you know, there's higher risk of litigation with higher risk treatments, right?
Yeah.
Stuff like cosmetic work.
Yeah.
Stuff like implant work.
Yeah.
Actually, I mean, I'm not. I don't know the true statistics on this. So, you know, keyboard warriors, I'm sorry. Okay, but you know, I would presume that the highest risk of litigation would come from stuff like failed cosmetic work. Whereas I tend to find that, again, talk to young people, that that is where they want to go. They don't want to do the routine care stuff. They don't want to be the general dentist. They want to be the cosmetic dentist. And naturally, that is actually, riskier, is it not?
Yeah.
What do you reckon?
100%. I think there is a lot of people who try and run before they can walk.
Mm-hmm.
But I think it depends on the person that you are. Like, for myself, mentorship's more important for me.
Mm-hmm.
I'd rather be doing a good job and be paid slightly less for it to begin with, and then know that I'm building up those competencies over time to then be able to charge more because I've got the skill there. Whereas for some people, their work will fail because they don't have the skill there. And I feel like you never taught composite bonding at uni. Let's put it that way. You never taught that. It's something you got to get extra skills to do. I mean, people could do it, but people could do it really badly.
Mm-hmm.
Patients never going to know fully until it fails, really. As long as it looks nice to them, that's what bothers them, how you made them feel, etc. That's what it's really about for the patient. But clinically, if it's done well, they're not going to know. You as a dentist, or maybe a nurse, will know. I know when he fails, the person who deals with that, whether it be yourself again or will it be somebody else, it's going to be the person that they're going to know that you've done a shit job, basically.
Mm-hmm.
And I think, I'm not against people wanting to do cosmetic dentistry. I'm part of the British Academy of Cosmetic Dentistry. I'm on the young membership committee, but it's taught to be done ethically and minimally invasive, and it's taught to be done in the right way and learning the skills in the right way, learning how to do it well. Start with small cases. Don't just jump into these big cases.
Mm-hmm.
Don't jump into rehab cases straight after FD, etc.
Yeah.
And I feel like that. I think people would want cosmetic dentistry. Yes, there's massive. I think social media influence on that. A lot of demand for it, but you're gonna have to still have those basic skills there because right now it's composite bonding. What will it be in the future? It'll be more veneers, more porcelain. People will be moving once this composite bonding starts to fail. It'll be more porcelain work that'll be.
That's interesting. Do you think porcelain's going to become more common? Do you think porcelain's going to be more attractive to young people?
I think there's only a certain
dentists,
number
I
of
should
times
say?
that your person will pay to have composite bonding done.
Yeah.
And that to a good standard as well, to make sure it lasts a good couple of years.
Yeah.
So don't start chipping after 6 months.
Yeah.
But I feel like it probably is going to be that. I think porcelain's going to be further down the line. People are going to start needing. People are living longer. People are going to need something that's going to be more long term.
Mm-hmm.
And I feel like porcelain will be. But then the skill set is going to constantly change. Like composite bonding was a thing 5-10 years ago. Like you might do a little bit of if somebody's got a chip, do a little bit. It wasn't never like a case of full set of composite veneers.
Oh, I know. I'm a dinosaur, remember? Now, you see, it's funny to me that you say that porcelain's going to become a thing. Porcelain, to me, has always been a thing.
But I think it's minimally invasive porcelain is what I'm trying to say. It's more no prep veneers, etc.
Guys, as you know, I am the lead tutor of the Hedro Academy Vertical Preparation course. Now, we have put together this beautiful vertical preparation kit, which has been beautifully made by Former Dental Supplies. Simon at Former has kindly agreed to give one lucky winner of this podcast a kit completely free of charge, which retails normally at £220 plus VAT. So all you have to do to win one of these fantastic vertical preparation kits is just give us a like, subscribe to the podcast and share it, and leave a comment below, and we will pick one lucky winner every podcast, and Burkit will be finding itself in your clinic. Okay, so yeah, great guys. The Horacle Burkit by Hedro Academy and Former Dental Supplies. Just going back to the litigation risk.
Yeah.
So obviously, there's always that, it's drilled into you from year one, you could get sued.
Yeah.
Yet everybody wants to go and do the high-end treatments but not really going to general practice. And I'll tell you where this is coming from. I used to own a practice obviously this is going out nationwide, worldwide indeed. So not everybody knows where Leeds, West Yorkshire is, right? So we are in West Yorkshire in the UK. One of the biggest cities in the UK is Leeds. And I used to own a nice NHS practice with good mix of NHS and private just outside Leeds in a town called Cleckheaton. And it never used to be a job trying to get an associate. But again, around the 2015, 2016 mark, recruitment was becoming so difficult.
Yeah.
And the feedback always was, well, you know, I don't want to work in an NHS practice in a market town outside a city. I want to work in the city centre. I want to do Invisalign. I want to do composite bonding. I want to do sexy dentistry, basically.
Yeah.
So it's kind of just like, you know, I don't know where the older dentists had gone. I think I have either just like decided to not do this anyway. Yeah, bought practices. You know, they are competent to do the high end stuff.
Yeah.
But you know, there was no younger guys and girls wanting to come in and fill those roles.
Yeah.
You know, so it's kind of just like there's just something missing, and I'm trying to just nail down what is going on and why is this recruitment crisis occurred, and you know, why is it that people don't want to work these NHS jobs anymore? Why is it that everybody wants to do composite bonding and sexy dentistry, but the skill set isn't there and the fear of litigation is there, but still they want to do the complex stuff? What is it? What is that?
Instant gratification comes to mind.
Wow.
I feel like somebody who's come out fresh, they want to earn a lot of money.
Right.
They want to be in the big cities, make a name for themselves, basically.
Yeah.
Have their own brand. You see people with their own Instagrams,
Oh,
this,
that's a
that, and the
big
other. A lot of
Yeah.
people do it. A lot of
I
people
know,
do it.
I
They
know.
they bring their own patients in from it. Then you have that, whose patients is it? Practice patients, is it?
Yeah.
You all have that kind of stuff going on with it. But I think instant gratification is definitely a thing. We're in a generation where we want something, we want it now.
Okay.
And like with, you know, mobiles, we want the latest mobile, we want the latest technology now. ChatGPT does half the stuff for us now. We wanted it. It went crazy on one of the dental forums. Somebody posted about it and, oh yeah, I've downloaded it. Everybody downloaded it and started using it. So it's just that if something can make your life easier or if you can have something quicker, people are going down that route because they want it. They want the money, this, that and the other. And I think it's one of those things is like people automatically assume that dentists are rich. I won't class myself as rich at all, to be fair. But that's because I'm happy to slowly work myself up that ladder as I build up my skill set. But not everybody thinks like that. And I think that comes from experience of my network and understanding people. I'm quite well networked. So I know you as well. I'm quite well networked. So speaking to, you know, some of the bigger names in dentistry in the UK, they've all done the NHS jobs. They've all done their slog in the NHS, basically.
The hard hours.
Yeah.
Absolutely. Yeah.
They've all done that
Yeah.
to be able to build up their competencies. But I feel like people want to pick and choose what they want to do these days.
Yeah.
Because it's what brings them that gratification. Like doing a composite bonding brings them that gratification, brings them the money. Why would they spend an hour doing a root canal, an hour and a half doing a root canal, where they can make more money from doing 4 teeth, for example?
And there's a fear factor involved in root canal as well, isn't there? Yeah, the dead patient coming in, you know,
I hate
worrying
root
about
canal.
having root canal.
It's one thing I feel like I'm the least confident in is root canal.
Right.
And I have a fear of it. Like the night before I do a root canal, I won't sleep.
Okay.
That's how fearful I am, because I feel like I can't. I've got loops. I've got 5.7 mag loops. I just feel like it's just one of those things I don't feel confident in, and I know I'll have to do more to get confident in it and competent in it as well. But it is one of those things. Is like I could easily be like, okay, I'm just going to go with a private job, send all mine to an endo specialist.
You know,
I
I 100% get that, and I've seen that actually. I've seen it. And I won't mention any names,
Yeah.
but it's just so funny that you mentioned that, because I was thinking this exact same thing just this week, thinking that this individual is doing very well for themselves.
Yeah.
But they're referring everything out of their practice.
Yeah.
And I was just like thinking, you know, because the mindset for me is always, I want to keep as much in-house as I can, you know?
You need to get those monospec people into your, because that's what it's going to be like.
Yeah.
This is something I was told actually. Things are going to start going more monospec. So basically, people are going to like start not necessarily specialising, but a dentist with special interest in a certain subject. So, a person might do a masters. The endos will stay in house then for that. They don't have to go and do a specialty training, but they do it in house. It means that somebody in the practice is still doing it. Doesn't necessarily mean you. It's not on your shoulders. But if somebody enjoys it, why would you want to do something? Why would you want to do something that you don't enjoy?
No, I get that completely, and
I feel like,
and that's fair enough. It's just a case of there is a lot of picking and choosing, as you said, whereas I'm probably from a generation where we did a bit of everything, and then, you know, as you develop a competence in one thing, then you kind of pursue that.
Yeah.
But there's a lot of picking and choosing going very, very early.
Yeah.
And I think that comes back to the instant gratification that you were saying, and that's so interesting. Do you think, well, in fact, let me just go back a step, because I wanted to ask you, do you think your undergraduate experience prepared you for independent practice?
No. I think anybody who says that, it probably gives you the bare minimum skills that you need to be able to go into practice and do a simple composite, simple root canal. But it's when things go wrong, you don't have that situation really in dental school, and you don't have enough experience, I don't think, to think that I come out of that and I feel like a confident dentist.
And do you think maybe COVID was the reason for that, or do you think had COVID not been a thing that you would have still had that, well, lack of preparation for the big bad world, would you say?
So I think for me, it's probably COVID wasn't really a massive issue because I only missed last 3 months. Whereas people coming out now, I think that's going to be a massive part of theirs as well. Whereas for me, I think like just having not as much exposure into the number of cases that we had, etc., I just feel like it was never going to be the case that I'd feel confident coming out of that. But I don't know if I'm just one of these people that I always question myself a lot. So I might just be one of these people that, I'm really shit at this. I'm really shit at this, really shit at this until I become good at it. I'm one of those kind of people, which are not always the best thing, because sometimes you can feel really shit after a day of work, so things don't go the way they are. But you are learning from that. But the thing is, the patient doesn't know that you're still learning from that. They just think you're going to be the same as every other dentist they've seen. And that's where the mismatch between a patient, what they expect, and what we can deliver comes into play. Because a patient...
Carry on.
A patient who's like seeing a dentist who's done root canal for 30 years and they've now retired or whatever, and then I come in and I've done 20 root canals or something like that.
Yeah.
I'm not going to be as quick. I'm probably going to be slower than them. I'm going to be probably a bit more shaky and nervous about it and everything like that. They'll be like, oh yeah, but they did it in like 45 minutes. Like, you're spending an hour and a half. Why is that? This, that, the other. If they had previous experience of a root canal. Oh, they didn't put this sheet on my face. Why are you putting this sheet on my face? Some people, I've had patients where they've not had experience of a root canal with a rubber dam on. Now, I can't obviously mention names and stuff like that, but it should have been the case where they should have had rubber dam placed, gold standard. So I think we're trying to do the best, but the patients are always questioning why things are differently to what it has been done previously. That root canal might have been really successful for them without the rubber dam on, but the gold standard is to have the rubber dam on. But they don't know the difference that we do.
I'm just going to tell you something.
Yeah.
Nobody qualifies, and it doesn't matter which era you've qualified in, being competent. You know, competent. I shouldn't say competent. Obviously, competent. We should be deemed competent. But nobody qualifies with that confidence of having 20, 30 years experience.
Yeah.
And that comes with anything. And I've seen that with young dentists now, is that there needs to be, for the individual, for yourself, or for your colleagues, that instant I'm great, you know, that instant I'm really good at this. But you can't be, because you haven't got the hours of the clinical experience behind you, and that's only going to come with time, and that's always been there.
Yeah.
So don't beat yourself up over that. Basically, that's what I'm trying to say. But no, it's interesting that you say that.
But I feel like then social media plays a part in that.
Well, huge, yeah.
Because I feel like certain forums,
yeah,
I've seen younger dentists post something,
yeah,
and some of the old generation,
yeah,
I think we all know some of the common names that come up, but some of them really go in on it. Oh, you should know this. You graduated, why don't you know this? Like, I'm all for getting a second opinion on something. If it makes my life easier and it makes me feel a bit more confident, and it gives that patient the confidence, why wouldn't I? I'd happily go to my principal and say, can you just double check this for me, or could you just look at this X-ray for me? Do you agree with me, X, Y, and Z? The patient's going to have two sets of eyes on what's going on. But I feel like some of them, it's like, oh, social media can be good, positive in some aspects, but in other aspects, it can actually be quite a toxic
for me
culture. And I've seen some of the ones, like, I've got a group chat with some of my dental friends, and we see things go off, and we just screenshot, and I was like, I feel so sorry for this person.
Yeah.
And we'll send it to this group, like, have you seen what happened? And we're like, oh God, like, this is what kind of stuff that scares me to post, like, a clinical case on my Instagram or anything like that, because I'm like, no, somebody's going to come in hard on me. I don't mind constructive criticism, but some people who say, oh, like, actually just hurtful and mean, that would really affect me. And I'd be like, even if I thought I've done a really good job.
So have you ever posted anything on social media? You haven't? Okay.
Not of my clinical work.
Yeah.
And not on the forums, because I'm shit scared, if I'm honest, about
Yeah.
posting, because I feel like people will come down on me a ton of bricks. Don't get me wrong, there's some lovely, lovely people, and I read people's comments. Like, you can have like 100 comments, a handful of them would be mean, and some of them would be quite insensitive to somebody who's actually had the balls to put it out there and put a case out there or something like that, to then just be thrown into the sharks, basically. Whereas people give really good advice, and I'm like, I've actually learned something from that. But I just think, personally, for me, I'll just sit back and be an observer, because I think I'm just too scared to. I'm more sensitive than people think. So.
No, of course.
And I feel like that was not my confidence, because I know that I'm critical of myself, and I know I'm critical of myself. So then why do I need people that don't know me on a personal level to criticize me in a horrible way? Give me constructive criticism.
Yeah.
By all means, I'm happy to take that on board, and I want to learn, but don't belittle me and do it.
What's the age group of the critics?
I don't know what their ages are, but they're I think they're the older than you.
Older than me.
Older than you. I think certain people, there's certain names that come to mind, and I think like most people can name a few of them, but I'm not going to mention names.
No, we're not going to mention names, definitely.
Yeah.
But it's interesting that you say that, because I was on a podcast last year, I think, or the year before, Michael Tang's podcast.
Okay, yeah.
One in the chair, two waiting, and we had a very, very brief chat about social media. And I don't post a lot on social media, because I have been on the receiving end of a lot of criticism. A lot of the stuff which I post is quite, as BOPT, we did the whole thing at the BACD in the conference last year, and it's still quite niche in the UK, whereas if you go to, Southern Europe, it's quite widely practiced, and nobody batters either. And, when I first started posting stuff around the 2016 mark,
I think I remember.
Do you remember? Did you see it? Did you read the comments?
I think I read the comments.
Mate, honestly, so for a period of time, I stopped posting, because I just thought, I don't need this. And I was talking to Michael about this, and yeah, there's a generation. They started off on Facebook who are older than me, who are super critical. And it's almost like when you post something on Facebook, it's not enough for it to be, enough to have a before and after shot.
Yeah.
You need to explain everything. It needs to be like a full protocol post.
Yeah.
And if you haven't explained and justified yourself, then they're all over it.
Yeah.
And then there's obviously the other side of it, where it's just before and afters, and Instagram is much more of a happy community where everybody just claps the post and says, "Wonderful, bro, amazing." But it can be, especially the Facebook side of things, very, very toxic, very 100%. Intimidating, isn't it?
Yeah, 100%.
So you haven't been subject to that. But okay, can I just ask you a question? How do you feel when one of your younger colleagues or somebody around your age group posts something fantastic?
I feel really happy for him, because I feel like I generally, because my cohort and somebody who I know and I've still well connected to, I know they've got similar values comes into it. And a lot of my friends have the similar values that I do. And for me, I know that they've done an amazing job, because they've done X, Y, and Z courses. They've expanded their knowledge. They've done everything they possibly can to do the best for that patient, because I know what kind of dentist they are just from seeing them on courses, being friends with them, discussing cases on WhatsApp and stuff like that. Little things like that I know that those people are doing the best for the patient. And I know how stressful it can be. Like some private patients, you want to write letters and stuff like that, and it can be stressful, and like send each other snaps that we're sat here till 11 o'clock doing these letters for these patients, like trying to be as detailed as possible without overwhelming the patient at the same time, because of that fear of litigation again. So I know that I feel happy people who I don't know around my generation who are posting stuff and it looks good, I'll like it. I'm not one of those people that won't be opposed to it. But if there's something that I'm a bit like, I would have done it slightly differently, I won't say that to them.
You won't comment.
Because
Yeah. What about though? I'm just going to throw it out there. Do you ever feel any pressure in terms of, wow, look at what they're doing? Why are they doing so great? Is there ever any sort of anxiety that comes around that?
I feel like there is always, look how good their work is. I think there's any dentist, I don't think that matters about which age you're at. Like, oh, look, their case is amazing. Like, oh, I can't do anything like that. But you probably can. You're just probably lacking that confidence to post something that you've done. But also, behind that one post that they've done, you don't see the 100 failures that's happened before that.
Exactly.
And for me, that stuck with me as like, how many cases has it taken them to get to a good case like that? That always sticks with me. I'm like, well done that you've got to that stage with that patient. But I'd expect the return, if I was to ever post anything, I'd expect, not out of just like, oh, yeah, I liked your post, you like my post, but I'd expect if they wanted to tell me some constructive criticism, please just message me privately. I'd rather do it rather than do it in a public forum where everybody else can see it. Because sometimes you can see some comments and it's just like, it's not necessarily. Whereas at times it's quite informative where there's an actual discussion and it doesn't feel like you're belittling the person, etc. And then you actually learn something from both why the person did it and the person asking. Like, it's like there's one recently that my friend sent a screenshot of in a group chat, and she was like, what do you think of this? So I went onto the forum, read through the comments between a certain couple of people, and I was like, I understand both sides. Like, I understand why he's done, and I understand why the people are asking him that question. But if it's worked in his hands and he's done it a couple of times and he's got results to prove that it's lasted, got longevity behind it, like that, I don't see anything wrong with that discussion being there. But it wasn't like they were belittling him. So I think that was quite nice in some respect, where other people can proper go in and you.
Yeah. And that creates a fear
Yeah.
to post. But then there are some people, and I say some people, there's most, I wouldn't even say most because you can't put a number on it, but there's a load of young dentists who, as you said earlier, create their own brand, do some composite bonding, stick it up there. And, it's just that to my generation is, I mean, don't get me wrong, I do it as well. But I personally felt, well, I need to keep up with the kids,
Yeah.
You need to keep up
with them, yeah.
keep up with what's going on. So no, it's interesting to hear that you feel happy for them. But there's no kind of pressure or anxiety around having to do it yourself. No,
I think there's always a little bit. I think there was at some point when everybody started, when I first started like using, because I wasn't a massive social. I didn't have Facebook, Instagram, or anything like that.
Okay.
Facebook I made once I joined uni, so I didn't have it before that. Instagram I made, I think, second to last year of uni, so it was quite late on. I wasn't, and I don't have TikTok, surprisingly. I don't have TikTok. And so Instagram's my main form of, but I think that I've used it more to network than anything else. So like people see me going on courses or doing X, Y, and Z. Post this up, don't worry. I'll go on my Instagram.
Thank you.
But yeah, and that's where I've made my network from. So I think it depends on what your Instagram is, because some people use it for other dentists to show them out their work. Other ones is for a patient base, to get patients in basically and show that these are the cases I'm doing. If you want to book in with me, this is the X, Y, and Z. So there's two different types of Instagram page you can have when it comes to dentists. And for me, I'm not at the stage where I feel confident enough I've done enough cases to be like, oh yeah, these are my cases, post them, etc. Because I feel like I feel like I'm always going to be this constantly do better. There's going to be a point where I probably will post something. And it'll just be a case of, I'll expect you to like it. I mean, is that all right?
I will like it. I will 100% like it, and I'll put a positive comment, constructive comment on there for you. Absolutely, I will.
What's that margin?
Listen, you know me. Well, you don't actually know me clinically. As I said earlier, I'm not uber critical about things. And I think there's a lot of stuff where you can just let a lot of things go and make your life easy. Going back to what I was just saying about undergrad then. So like that didn't prepare you.
Yeah.
Do you feel that your foundation training year was really then, something that you relied on? Was it really that, did that help you? Was that more, well, I'll tell you where this is coming from. When I was what we called VT at the time.
Yeah.
VT was more a case of, we'd be expected to see maybe 15 patients a day.
Okay.
And it was more a case of, it was definitely still a training environment, but it was a case of we'd knock on our trainer's door if we had to.
Yeah.
We shouldn't really confess this, but the tutorial was more a case of, let's go out and get some lunch and we'll have a chat over lunch, It was nice.
Yeah.
Now I know that it's a very, very structured learning environment. It's almost like a continuation of dental school being a dental practice. Am I right in saying that?
I think it depends which practice you're in.
Okay.
I think that makes a massive difference.
Right.
Just speaking to the people that I know, some people's are very, very structured.
Yeah.
And, by the book. Needs to be a tutorial, needs to be an hour.
Yeah.
Other places let's do 2 tutorials in one lunchtime. Get it over and done with.
Right.
30 minutes, 2 tutorials, get it over and done with, tick 2 boxes, or go through a case, and that's classed as,
A tutorial.
tutorial, yeah. And I think it depends very much on your trainer, the practice that you're in, and where they are in that training. If they're coming up to, they're a new trainer, they're probably born by the book. If somebody who's coming out of it would probably be more lenient in what they do with you, basically. Very much so. Like I didn't just knock on my trainer's door. I knocked on. We had an open door policy at the practice I was working in, so I'd knock on anybody's door and just ask them if my trainer wasn't there.
Yeah.
And I was quite happy to do that. I'm not ashamed to ask for help. I'd rather ask for help than fuck up. That's basically what I think to myself. If I can ask for help and it makes a difference in what I'm thinking I'm going to do to this patient, why wouldn't I get that help?
No, absolutely, and that's what it's there for.
Yeah.
But do you feel that?
Do you feel it prepared me? Absolutely not.
Oh,
If I'm honest.
foundation training?
No.
Really?
I think a massive difference was that all our study days were virtual.
Right.
So we never had the hands-on in clinical skills labs because of COVID. So we never had the hands-on experience. Like, you wanted to do a root canal study day, you'll be a webinar for 4 hours online.
Yeah.
You don't concentrate after about 30 minutes.
No, absolutely.
You might be on your phone. You might fall asleep.
Oh.
Nobody's going to know.
Yeah.
All of our study days, I think bar 2, were online, and that was because it was coming to the end of those 2 years that we started to see face-to-face. So I think with that aspect of extra learning stuff, obviously patient-wise, you'd see more seeing more patients. That's just part of any FD, VT. And so for me, the study days made a massive, it was just bad because sometimes you'd have a full study day, 6 hours of learning about, I don't know, oral medicine or something like that. It's not the most interesting, it's not the most, I wouldn't say it's interesting, but I mean, it's quite a dry subject for some people. It's quite a dry subject for some people. So just try and concentrate for that do 3 hours in the morning, then go for an hour break and then come back for another 3 hours of it. It was just shit.
Now, is that just because it was COVID, or does it continue to be remote learning?
I'm not 100% sure. I think there's more face-to-face now than there was previously. But certain things, you can do. But how can you teach endo on virtual?
No,
How can you teach composite bonding or composite?
And what about the actual clinical aspect of it? Did that? Surely, because from what I gather, that you're not getting a lot of undergrad experience, first of all, in the dental school. So surely then, do you feel that? Because I'll tell you where this is coming from. I was a trainer, as you know, because I know you wanted to join my practice, but then I stopped being a trainer.
Yeah, exactly. Exactly. Just before I was going to come, you were like, nope, I'm not having you. That's what it was, wasn't it?
Yeah, you made me quit foundation training. No, not really. I noticed again, and this isn't a criticism of any of my FDs, because I loved all my FDs. We all got on like a house on fire.
Apart from the 7 you mentioned, no, I'm joking.
Absolutely, the other 7. No, I was over a decade. I did foundation training, and had lots of great people come in and out of my practice. But it did go from being more of a knock on my door if you need me, to really getting down and doing things for the first time. So I'm presuming that's what it is like now, as a standard, really. It is a continuation of a training environment in practice, isn't it?
It is.
Do you feel?
It is, for definite. I learned a lot clinically by seeing patients and seeing some of my failures. If something came back 3-6 months later, what went wrong? What did I fuck up on, basically?
And you didn't post that on Instagram?
No, I didn't post any of it on Instagram. Not even my good work on Instagram. Just scared that you were going to troll me now. But what I was saying is, it 100% clinically you learn a lot, but I think there was an aspect of some of the FDs being taken advantage of in certain circumstances. I think that some practices, from what I'm aware of, because of COVID, and FDs UDAs were counting towards the practice contract, the trainers UDA totals. So in some aspect we were treated like an associate. 10-minute checkups, some of us were having 15-minute checkups, some of us having compared to 40 minutes. I see now some FDs getting an hour still for a checkup, and they're nearly 3/4 of the way through there. For the training, I was like, oh, you're going to be in for a shock when you when you hit associateship.
That's not a good thing.
It's not a good thing, but the other side of things, neither is giving a 10-minute checkup to an FD.
No.
Because I feel like the last thing I want to do is cut corners because you just get into bad habits and they're going to stick with you, and that's where you're going to slip up on. If you're going to be a good dentist, you've got to do things well and you've got to have the time to do them well.
Mm-hmm.
You can't pick and choose between that. And I feel like you kind of get sometimes that you treated a bit like an associate. It kind of gave you that knowledge of what associateship might be like, but it also meant that you were in a bit of a treadmill just to get the numbers, basically.
Just throwing it out there.
Yeah.
Do you not think that's necessarily good practice for what's going to come only a few months after?
I mean, yes and no. I think no, because I don't think 10 minutes checkups are, even if you've seen a patient for 30 years, I still don't think 10 minutes is enough for a checkup. How are you supposed to have that communication with a patient? Talk to them, build that rapport with somebody, do a clinical examination, do your notes, all that, and then maybe x-rays as well if they need them. All that in 10 minutes.
Yeah. No,
I'm not
I
a
agree.
machine.
No, I agree. And that's the reason why I kind of left NHS dentistry as well. And I do have longer for my private patients, private checkups. You can do all the things that you said.
Yeah.
So kind of then, I suppose that leads me on to the next thing. What kind of a job are you, well, you've only just finished your foundation training, so what kind of a job are you doing? What kind of a job is a young dentist like you looking for once they finish their foundation training?
So I think it depends. I think some people are happy with taking on an NHS job, and
Are they?
some people
Are
I
they?
know.
I don't know.
done.
I'm throwing it
Yeah.
out there because, as I said, for me personally, recruitment became so difficult, which is why I ended up
It
selling
is
up my
very much
NHS practice.
It's very much an associate's world right now.
Right.
There's more associates who can pick and choose what practice they want to go into now, and practices are just like begging people to join, basically.
Yeah. Are we
think-
talking about NHS practices?
Yeah,
Yeah, exactly.
and
yeah.
I think some people are happy with taking on a 7,000 UDA contract.
Still?
I know
Are
a
they?
few. I know a few.
Okay.
So I don't know if that's just a few people that I know. I know a few people who have taken on quite large UDAs, and something that my TPD told me was never take on more than 1,000 UDAs per day that you work. So that's something that stuck.
5,000.
1,000. So if you did
so
5
if you're
days,
doing like a 5-day week,
Yeah.
basically you should never
Yeah.
do more than
5,000
5,000
UDAs, yeah, to be like to work safely, basically,
Right.
and to work well. The other thing was said to me was never work more than 4 clinical days, and I only do 4 clinical days because I need that 1 day of admin,
Right.
and I need my weekends for my family.
Right.
That's really important to me. I lost my father a year and a half ago, so it made me realise that the perspective and everything like that, really putting things into perspective for me about what really matters. Working 6 days a week, I still make money. If you work well and you work effectively, you can make as much money doing 4 days as you can do in 5 days. And it's what kind of work you're doing, really. But I think this is where it comes into it. People want to move towards more private because not just because of the money. I think a lot of people think that young dentists want to do that because of the money. I think it's more the pressure. The pressure of NHS dentistry is ridiculous. When I'm working private, on my private days or my private patients,
Yeah.
I'm so much more chilled. I've got the time. I can speak to the patient.
Yeah.
You know what? Private dentistry is a lot about the communication that you have with the patient rather than my clinical ability won't change from an NHS patient to a private patient. How long I will,
Yeah.
that depends on, obviously, how long I've got will depend on the outcome of what I do. But I think it's just that a lot of it's communication. A patient just wants to sit, have a 5-minute chat rather than get in the chair, let me do your treatment, get out kind of thing. So for me, I think there's a lot of the stress that comes with it. Dentistry is stressful as it is, but I feel like the added pressures of targets, UDA targets, clawback, this, that, and the other, people don't want to have that kind of thing. They want to do the best for their patients, and they want to do it well. So why would I go for a job that I'm going to have to cut corners from, spend less time on, my work's going to fail, the patient's going to go back, they're going to be pissed off. Am I likely to be sued? Why would somebody want to do that?
Yeah.
That's
not attractive, is it?
It's not attractive at all.
Yeah.
Anybody who says NHS dentistry is attractive at the moment, come and speak to me.
Yeah, it's just really interesting listening to this because it's kind of like my generation. We were expected to just go and get on with it and just do it. And then, like, private dentistry wasn't a huge thing 20 years ago. It was there. Of course it was there, but it wasn't.
Were you fee per item back in the day?
I was fee per item only for a year.
Okay.
And then
banding.
Then the UDA system came in 2006. So most of my I quit NHS dentistry, as it happens, for all the reasons that you've just said.
Yeah.
Around 2013, 2014.
So you still did it for a good slog.
Oh, I did it for a good number of years.
Did you enjoy going into work?
Yeah, I did.
Did you find it stressful?
Yeah, it's always stressful. But the funny thing is that even private dentistry is stressful.
I think
but
it is.
different ways.
In different ways, yeah.
There's more expectation, more,
I've just found
it's
that.
high risk.
It is.
Yeah.
But that's more on your shoulders, isn't it? Rather than just, as in like it's patient selection, choice of patient.
Yeah.
If you don't want to see somebody.
Which kind of, I suppose if we just like talk about a flip end of, you're a dentist, you want to do the best for your patients, you want to do the dentistry that you have been trained to do.
Yeah.
But then there's a whole population of patients. I'm getting really social and political here. There's a whole population of patients who can't afford private dentistry. They need those NHS services. Who's going to work those services?
I do Dentaid. Have you heard of a Dentaid?
I have, yeah.
Yeah, so I do that.
Yeah.
I feel like I still, even though I work NHS job, I still do that because I feel like people do need it.
Yeah.
NHS dentistry as it is not fit for purpose.
Yeah.
If NHS dentistry changes, say if it goes back to fee per item or it goes to a system where you're able to do treatment and you're able to take as long and there's not these horrible targets and clawback, people would stay in the NHS. I feel like that wouldn't be an issue. And I feel like a good thing for people say is that, stay in the NHS until you have your kids. Maternity care for the amount of UDAs you do. It's like don't come out of NHS dentistry until you've had your kids, etc. So I think there is some benefits to NHS dentistry.
Massive benefits.
Yeah. Pension, for example, as well.
Ooh, that's anyway. That's a topic for a different day. Oh, I'll just quickly throw it out there. If I cannot start taking my pension, obviously you can buy back your years, but if I can't start taking my pension until I'm almost dead, it's not for me. I'm almost there. I'm almost dead. I'm that much of a dinosaur to you, huh? So no, that's why I went for a private pension quite early on, because then I've got more flexibility with that.
Yeah.
But there are other benefits to it, definitely. But no, it's just interesting to hear that. Hi guys, are you thinking about getting into dental implantology? Well, if you didn't know, I'm one of the founding members of Unique Implant Training. Unique Implant Training is now in its 5th year, and we are now fully EduQual accredited to diploma level, which is an 18-month diploma, the only 18-month implant diploma currently in the UK. So if you want to begin your implant journey, please don't hesitate to give us a call. Find us at www.uniqueimplantraining.co.uk. We look forward to seeing you soon. So you do stuff with Dentaid, huh?
Yeah.
So what do you do with Dentaid?
So Dentaid, we see patients basically come in. We'll see patients that don't have lentis, basically. Children, adults, anybody, normally for emergency appointments, stuff like that. So people who come in. I'm all for, people do need, but I think the education is lacking as well.
Are they, can I just very quick ask, are they like, forgive me, are they like people who are really hard up? Or are we just talking about average working families who come in for these emergency appointments?
I think it's becoming more and more average working families as well now.
Yeah.
Because there's a struggle because, recession.
Yeah.
There's energy crisis, this, that and the other. There's all these expenses.
Yeah.
Dentistry is not going to be the forefront of somebody's... People, I think, seeing it more of a luxury rather than a necessity to see the dentist. And I think that's where the mismatch is between patients and actual general oral health, looking after it. There's massive things people don't understand, like the connection between like diabetes and perio, etc. People don't understand that, if the diabetes is not well controlled, they can get perio, etc. Patients don't understand that until they've had that conversation with you. I was like, this, that, and the other.
Of course they wouldn't. But I'm just thinking that, you just mentioned Dentaid. We talked about people don't want to work NHS jobs. Then I work for Dentaid, and that's lovely. But isn't Dentaid, immediately what sprung to my mind is just like, forgive me again, people who are maybe homeless and they literally have nowhere to go.
We have the mobile van as well.
But the average Joe, the average, person who maybe, they work in a supermarket and they're just doing, jobs on on that level of income, surely they need NHS dentists, not going to a charity like Dentate, right?
Yeah, I think
Yeah.
I think there is some private practices who do quite. To be fair, I know some practices who charge quite cheaply for a new patient exam. It's a couple of pounds more than NHS. So it's not the case of you have to be really expensive to be private, but the NHS system and the banding system, especially with COVID hitting,
Yeah.
patients are coming in with a lot more problems. Until November, when you've got the 5 UDAs, 7 UDAs came in. Before that, you could have been doing 10 fillings on a patient
It's a mess, isn't it?
and being paid for the same as doing one.
Yeah, it's an absolute mess.
And this is what I was trying to explain to my mum. She was like, "Do you not get paid?" And I was like, "No, I could spend like 5 hours with a patient and be paid the same as seeing them for half an hour."
Yeah.
It's crazy.
It is crazy. And it's always been pretty crazy since 2006. At
I think
least
it has,
under
but I
the
think
old system.
COVID,
Yeah.
people have obviously not seen the dentist.
Yeah.
They've a lot more problems, a lot more disease,
Yeah.
so that they need a lot more treatment. So it's even more so the case that you see more people for extractions, root canals, etc., than you would have done if they were we were regular through COVID. Obviously, we couldn't be, but I mean, if we were regularly seen, we'd catch things earlier. You go 2-3 years without seeing a dentist, you could literally fuck up the whole tooth. Like you could literally do
Yeah,
extraction.
I saw a lot of that,
Yeah.
when we first came back after the pandemic. A lot of stuff to clean up, but obviously I look after a much smaller population, maybe in a private practice, and we cleaned that up pretty quickly, but it took a long time for the big Nash practices to do, didn't it?
Still is.
Yeah,
Still is.
it's still going on,
Some patients
Yeah.
have not been, like some of the patients that I've seen have not been since 2020,
Wow. Yeah.
early 2020. So yeah,
Oh,
it's
dear.
crazy.
Okay.
Or if they've not 2019, some of them have, and like, it's the thing is like everybody's looking for an NHS place.
Yeah.
There's literally
And
nobody.
nobody's taking on, and why would they?
Yeah.
It's just such a rubbish system.
People are looking to give back their NHS contracts.
Yeah. Can I just ask you? So, just going, I know I keep going back.
Yeah,
we
no, it's
keep going
fine.
off on tangents, so that's great. So, can I just ask?
Yeah.
We talked about your undergrad, then we
Yeah.
talked about, the VT experience.
Yeah.
Did it prepare? Did it not?
Yeah.
And one thing which I noticed, and that's another reason why I reached out to you, because you are involved with the BACD.
Yeah.
And you've been involved with the BACD since this undergrad, right?
Yeah.
Since
Yeah.
your student rep.
Yeah.
Is that right?
Yeah, that was correct. Yeah.
Now, I'll be honest with you. I would look at that maybe a few years ago and just be like, you're a student. Why are you getting
You
involved
snobby
with...
bitch.
Yeah, exactly. I'm a snobby bitch. I'd be thinking, isn't the BACD, it's an elite organisation. I'm involved with it as well. Not as heavily as you, but don't get me wrong. I love the BACD, but I always traditionally thought in my head I'm on the fringes of it. By the way,
Yeah.
So in the sense I'm not involved at board level like you are.
Yeah.
So I'm just a member. So it's a case of, to me, traditionally, organizations like the BACD, the FGDP, BARD, all these things, they're kind of like, to me, were kind of like elitist organizations for experienced clinicians, right? It's not that at all. I mean, I spent a lot of time with you guys at the conference this year, and what a lovely, warm bunch of people, the BACD are, and it's lovely.
I was the warmest.
You were the warmest, absolutely. Thank you for your hospitality. So...
Help you set up. Don't forget that.
Absolutely. I did a full hands-on session and Imaan helped me set up, and she was so kind.
I did basically all of it.
She did everything. Thank you. Thank you. So to get involved at such a early stage, where you haven't even graduated yet, I would have looked at that a few years ago and thought, what's in it for you, kind of thing. And it's just like, what kind of dentistry is this breeding? However, I now see that it is actually probably one of the most important things that you can do.
100%.
Given that you have a lack of clinical experience, from an undergraduate level, then there's foundation training, and you may or may not get on with your foundation training practice. It may or may not be a good experience. Then you're thrown out into the big bad world, right? And then you've got all the pressures as a dentist of your age and your era, that you've got all your friends on social media posting all these lovely composite bonding pictures, befores and afters, and you haven't had the guts yet to post your own before and after, but one day you will. So something like the BACD, being involved with an organisation like that is just so important, isn't it?
100%.
Yeah.
So for myself, I was what people call a keen bean, a nerd, a geek, whatever you want to call it.
Yeah, definitely.
I feel like for me, is there was a couple of things that I started off with, just doing a couple of extracurricular things in probably
Yeah.
second year was the first time I did something. I actually went to London for the first time by myself, and it was like a bit of a like, oh my god, I'm going by myself. We're going to a conference.
Yeah.
It was called the Make a Dentist conference,
Yeah.
and I did that, and the amount of students and the amount of people that were so welcoming. It is, it's quite a ballsy thing to do as a student. But it just made me realise that, people are really accepting of students coming to things.
Why did you do it? Just out of interest. What prompted you to go?
There was a lot of speakers on there that I'd like heard of and people had spoken about, and different specialities, this and the other. And I was like, this actually sounds really interesting. Let me go. And I actually became ambassador for them for a while as well. But for me, I think the main point for me was getting involved was around the time that my dad fell ill. I lost a lot of friends during that time because people couldn't understand that my social life wasn't a priority anymore. My family was. And for me, it was an escapism to get away from all the difficulties I was having, because my dad was quite unwell for 3 years, bedbound for 3 years. And that was a bit of an escapism for me to try and go to these events, because I feel like I lost my friends in uni, if I'm honest, through that time, because they just didn't understand the same concept. It was quite a sheepish culture there was. So I started doing these extracurricular things, and I found that the people were so receptive and so welcoming to see a student want to come to events. And do you know what the thing is? It massively expanded my network, and it made literally like, oh, the students come to like 2 of our events, like, let's give her a course for free, let's do this. So I was doing a course as a student that people were paying like a couple of £100 for, or 1,000 quid for free, and I was getting the same experience as them. So I was picking up these early skills, doing things differently that I could then implement even on patients that I was seeing in the dental hospital. Obviously, it was a bit more of a touchy subject with some clinical tutors were like, oh no, you need to do it X, Y, and Z way. But I was like, the evidence is now there to suggest we could do it ABC way, kind of thing. And it made such a difference. And BACD was one of them. Dental Tubules was another.
Okay, yeah.
Just a couple of local dentists as well who helped get me on some of their courses and stuff like that as well. BDA was another as well, because I'm general sec for West Yorkshire for them as well. So a lot of different things. So I was able to network massively, and it's quite funny because it's a bit of a full circle. So I was a student. 2019, I was a student, and I was involved in BDA. 2 members of Dental Tubules, they're part of Dental Tubules, but they came to speak for the BDA. So Kevin Rose and Simon Thackeray came to speak, and I was a student at that time. And I actually went to another Dental Tubules event yesterday in the evening, and Kevin spotted me, because this is the 3rd time I've seen you, and I've seen you go from being that student sat on the floor, because we knew you were a student because you were sat on the floor.
Sat on the floor.
I think there was not enough seating, so I chose to sit on the floor to give.
Was it a full house, or did they just put the students on the floor?
No,
anyway?
it was full house.
Right.
So
Okay.
and like, it was just seeing. It was like, I've just seen how much you've become involved, this, that, and the other, how much difference it's made, like how much of a keen dentist you are. Like, there's a certain cohort of people who want to continue to learn. That, for example, BACD. So I was a student rep, so literally massive part of. Even before I was a student rep, I was already going to some of the events, this, that, and the other, because it really made me connect with some of the people, and like, this kind of dentistry I want to do. I don't want to start cutting corners, this, that, and the other. And it was so nice to see so many like-minded people as myself, and it was like made me realise that, when you leave university, you were going to be friends with a handful of people. And when I did actually eventually lose my dad, a lot of the people who were my strongest support were actually elder dentists, elder people in the dental community, not necessarily just dentists, who really looked out for me and really supported me through that time. And it just made me sure if I didn't do what I needed to do back then, I wouldn't have that support now. And for example, if I'm stuck on something, clinically or non-clinically, something dental related, I've got somebody I can turn to. I could pick up the phone and call. Like last year, I was having a conversation with Chris McConnell, a past BACD president, because I was upset about something. And he literally gave me the truth of size, to pick up the phone and be able to speak to him. He sat in Cornwall, I'm sat up here in Huddersfield, and have this conversation with him, and he'd be frank with me, and this is X, Y, and Z, and why this, that, and the other. Another person, Shaz Memon, Digimax, he was a really big support for me as well throughout that time as well. Even now, like, we have, I have a lot of laughing jokes to a lot of people and stuff like that. But I know the people that I can turn to if I'm struggling with something, or they'll point me to somebody who they can. Like another thing I had about an associate job, I was speaking to Andy Acton, who's from Frank Taylor and Associates, and he really he's not a dentist, but he really went out of his way to help me.
Yeah.
He rang me on a weekend and we had a conversation, and by the Tuesday I was all sorted out with the issue or the problem that I had. So I would have never known these people if I'd never joined the BACD, dental tubals, etc. I would have never come across people who are in the dental community but not necessarily dentists.
Mm-hmm.
And I can just literally pick up the phone and ring them. Whereas some of my counterparts, they'd have to pay for some of the stuff that I get for free, or just the advice that I get for free. If I've got a clinical case, I can literally just send a picture across to somebody on WhatsApp and I'll get an answer within the day.
Mm-hmm.
It's not something I have to, you can pay for mentorship, and I don't see why that's a negative thing either. Some people, taking the time out of the day. But if you've got a support network and you've got a mentorship there from people who are willing to give it free because they see that you've got the passion there, they will offer you that free advice. They'll offer you a certain way to do certain things or a pathway that'll help you to get to where you want to be. And I think that's made my life so much more easier in respect of anything I do, like courses wise, clinically wise, just building my confidence that I know that I've got somebody on the other end of the phone if I ever get stuck, if I ever fuck up.
Yeah.
I've got somebody there to help me, basically.
Yeah.
The other thing is, and I think another thing that's people are like, oh, you go to these events as a student, why are you doing that? Other students, or there was a picture, of me, Monique Vassant, Simon Shard, and Tom Crawford Clark, I think it was, and we were stood, and it was at the BACD after the gala dinner, and somebody was like, oh, do you only go to these events so you can take pictures with, Insta famous dentists, etc. and stuff like that? And I was like, I know there's people on a personal level, I can have a conversation with them. I've met them so many times now that I can have a conversation with them. It doesn't feel like I'm speaking to somebody who I don't know. So for me, it's people can say what they want, but if it's helping me, I don't give a fuck what other people think.
Fair enough.
In the nicest possible way.
Yeah, no, fair. And it's obviously helped you, and so it's very important. And it's important for, because again, there's been, over the last short of 10 years, an explosion of private courses, multiple diplomas, postgraduate certificates. These have just exploded, over the last 10 years. And there's a need for it, isn't there?
Yeah,
because
100%.
just, if you're not getting that experience at undergrad level, then you need that, that support after you graduate, really.
Yeah.
So, it's a great institute, is the BACD, and lovely people.
Yeah.
And it's very nice that you're part of that. So can I just ask, just to finish, really, you've come out of dental school, you've done your foundation training, you're involved with the BACD, you've got loads and loads of private courses under your belt. Yeah. What's next for you then? So what does somebody in your age category look to achieve? What is the pathway? Are you going to go into? I mean, I know this is different for everyone. We can't speak for a whole generation, but what's somebody your age, what do they normally look to do? And then what are you personally going to do? What are you going to look to do?
I think there's a lot of different pathways. So some people continue on with DCT.
Right.
And then go into specialty training. I know a couple of people who are doing that.
Yeah.
Another thing is people just solely going into private practice or trying to get in private practice. One of my friends is now completely private practice.
After how many years?
So she graduated the same year as me, and she's moved to. This is another thing. She's part of the BACD with me, and she's solely moved both of her jobs. She's moved to London now.
Right.
Well, she's transitioning to move to London for both her jobs now in London.
Yeah.
And that's purely through being involved with the BACD.
Right.
She's been offered those job opportunities.
Cool.
So
sorry to go for the tangent, but does she feel confident to be able to tackle that?
I feel like because she's got the mentorship there.
Then yes.
Yeah.
Okay, that's cool.
And I feel like there's always going to be a part of you like, oh shit, am I good enough? There's always going to be days where we feel like we're a shit dentist. We all three of it, one of my group chats, all three of us, we had a shit week at the same time.
Yeah.
I was complaining about something, and then one of them fractured a file in a tooth. The other one, a patient was complaining or something like that. We all had something shit going on in the same week, and we literally said to each other, like, thank God for this group. Like, we'd be lost with each other.
Sorry, I mean, again, I know I'm going off on a tangent, but then again, just going back to this whole social media thing, nobody talks about this on social media, right? So surely, I mean, the thing is, you've got your head screwed on, so you know that this goes
Just
on,
about.
right? Just about. Surely there must be a load of dentists out there, young dentists,
Yeah.
who social media is all they've ever known. You know, it's part, they've grown up with it. And, you know, there's that whole, let me just post my perfect dental life on
Yeah.
Instagram. And then something bad happens. You've got your WhatsApp group
Yeah.
of 3 friends.
Yeah.
Somebody who's kind of by themselves must think, why the fuck does this keep happening to me? Am I a shit dentist? You know?
Yeah.
Do you ever hear these stories?
I think less so. I think people are don't like to discuss their failures.
Yeah.
And I feel like it has to be a very safe space for somebody to discuss their failures, because there's very little people out there who would support you through your failure.
Yeah.
I think more people would like to see you fall than actually see you rise. Just in general, really, I think there's less cheerleaders out there and there's more people who probably want to bring you down.
Yeah.
And for me, having a safe space, and that I know that group's a safe space. We could talk about anything. If you saw through that, you'd see how,
I mean,
not even all dentistry related stuff, but there's some funny stuff out there as well.
You know what? You're a happy person. You're sat here. You're talking to me. Big smile on your face.
Yeah.
You really love what you're doing. But you know, talking to Tony Kilcoyne, talking to Shafik Ali, who's also on this podcast, a few weeks ago.
Yeah.
She does a lot of stuff with Mental Dental on Facebook and what's I've forgotten the helpline that she set up as well.
Yeah.
I do apologize. It's in a previous podcast.
Yeah.
But she helps people who have problems, crises in dentistry, and she goes, about 80-90% of the people that call up are young dentists who are really, really struggling.
Yeah.
So I just feel kind of, I feel sorry for your generation, because there's so much pressure on you guys to perform really well because of everything that you see on social media, but then you haven't kind of been given that undergraduate and even then, postgraduate kind of like experience to be able to execute the cases that you all want to do.
I think a lot of it's swept under the rug. I think people don't like to talk about their failures or if they're struggling with something.
Yeah.
And I feel like that's because people will think that it puts them in a vulnerable capacity, really. Something that somebody mentioned the other day was like, if you've done something wrong, for example, if like an associate does something wrong or a principal does something wrong, report them to the GDC. They end up doing like reporting each other to the GDC. So the principal will report the associate to the GDC. The associate will find something to report the principal to the GDC about. Nobody's going to win in that situation. So if you're scared about people, like you've done something wrong, people are going to judge you on that. And I feel like it's very much, you don't know who's going to say what or do what. And that's what I'm saying, that safe space, that you know that even if things didn't go right, you've got people that you can talk to who understand you. And I think, something like, an anonymous phone call, you can have that conversation. They're not going to know anything. It's going to stay where it is. It's a safe space for them. Whereas I don't feel like Instagram, social media, Facebook, etc., is very much a safe space for a lot of people.
No, absolutely not. And personal opinion, I absolutely hate social media. I think it's just...
I won't post you then.
It's there. I don't know. You probably think I'm a hypocrite because I do post every so often, but it's kind of just like... I just think it really has, caused a lot of damage to the profession. But anyway, that's a topic for another day.
Yeah.
But going back to you, so what's next for you?
So for me, I'm currently in the process of looking for a new associate job.
Cool.
A bit stereotypical, but I am looking for a bit more private potential.
Right.
And I just want to see how that goes. I want to be somewhere long term, so I can see my clinical failures and what I can improve on. I think that's really important, is to be able to look back at your work and see how shit what looked good at the time and how shit it is 5 years down the line, and see where it failed or where something could have been improved. And I think that's really important. So I want to stay somewhere long term. I don't want to chop and change between practices, because you'll never see your failures that way. And I think that's really important to have. And I think you need to have a practice which has the same kind of ethos as you do. And that's really important. Some of them just want you to bash out the UDAs or bash out the patients, make the money. Other ones actually genuinely care about the patients, and that's the kind of practice I want to be in.
Yeah.
And for me, it's just finding that. And like I said, it is an associate world right now. So I've been offered a couple of jobs already.
Brilliant.
I'm like, I've got a couple that I'm waiting for.
Yeah.
Like to go and visit the practice this week, next week, and I'll make my decision after that. Because I feel like I want to fit in well where I work.
Yeah.
And I want to do the dentistry that I want to do
Mm-hmm.
and do it to the best of my ability. I think that's really important.
Still only 4 days a week?
Still only 4 days a week.
Still only 4 days a week. Amazing.
I feel like
Yeah.
one day off, just all my admin,
Mm.
all my extracurricular stuff, I can get all that stuff done.
Yeah.
Get that done, and then the weekend with the family. Or sometimes, for example, I'm saying 4 days. The occasional I'll do the 5 day for a Saturday that I'm doing privately.
Okay.
So and that'll be a half day, won't be a full day, anyways. So it just helps me having a day off during the week. It helps me spend time with my mum, because me and my sisters take it in turns to spend time with my mum at home. But then on the weekends we're all together, so that's nice.
That's really lovely.
Yeah.
And power to you.
Yeah.
Very good. Very good. Well, listen, thank you so much for coming in today. And
Thank you very much for having me.
no, it's been a pleasure, and thank you for, giving me an insight into your world,
Yeah.
giving me an insight into your generation's way of thinking,
Yeah,
which is very different to my generation's way of thinking, and that's why I'm doing this, because
Yeah.
I want to learn, I want to understand, what's changed,
Yeah.
really. And it's been very, very insightful.
yeah,
Very, very, I've learned a lot today.
yeah.
Well, I'll tell you
The
what.
student became the master.
The student became the master. Which I'll tell you what I found really interesting is how somebody, TPD would tell you that you don't want to be doing more than 1,000 UDAs.
Yeah.
You don't want to be working more than 4 days a week. It's
Yeah.
kind of just like, I just remember, and it's a generational difference, definitely. And in fact, Tony Kilcoyne's going to come and talk to us about the difference between the generations. And, this influences the way people are taught. We'd learn in different ways, but also what our aspirations and expectations are and how they differ. When I qualified, I was, really chomping at the bit to just get out there and work. Maybe they still exist. Maybe people like this still exist. I don't know. But, I, for quite a few years, worked 7 days a week.
Weirdo.
So, you say that, but that's normal. There's so many,
Did you not
people.
feel burnt out?
Yeah, but just go.
Did you just feel that was a norm? You know what the thing is? Okay, I think COVID has changed a lot of people's perspective of what they value.
It certainly changed my perspective. And that's
Exactly.
why I slowed down. Yeah.
There you go.
But prior to COVID, I was going.
I
for
think
it.
that's what's where the COVID era, right?
Yeah.
So we were in that position where we never got to say bye to our friends. Everybody went off to do their separate things.
Yeah.
Like, people lost loved ones, etc. It makes your perception of everything changed because of COVID.
Yeah.
And I think that's why people are slow down. I want a house with a garden rather than a flat. Do you get me? There was an uptake in that houses being sold with gardens and people moving out of the city because you could go anywhere.
Yeah.
And it's how much you'd valued a little bit of green space.
Yeah. I just think that I'm slow to catch up with what the current way of thinking is. That's all. So
Do
you've
you
enlightened
regret
me.
working 7 days a week?
Never.
No.
No. And
Did your back not hurt? Did your neck not hurt?
it did. And
Come on, crippled.
yeah, people look at me now and think, "Oh God, is he only like 41?"
We'll get you some Botox.
Yeah.
Don't worry.
No. But it's no, seriously. I just maybe there's maybe it's something to explore in another podcast. The psychology behind work, I don't know, but I always just I'm gonna get out there and I'm just gonna go for it. I'm gonna hammer it out. As
But if you do
much as I
good
can.
dentistry, the money comes.
It does, but I'm not just a
that a but?
dentist. I'm not just a dentist.
Do you remember? Don't forget, you're a husband and you're a father,
I am
and that
indeed.
should become before anything else. Spending time with your family.
Oh, and it does, absolutely, it does. And my wife helps me to know when to help me do everything that we do together.
Yeah.
So absolutely, yeah, no, it's a joint effort. But it's just interesting to hear that 1 day a week is safe for admin, whereas for me, it was like that you just do in the evening. But times change, and that's good, and that's cool. It's interesting to hear.
Yeah.
So there's power to you, and there's nothing wrong with it. Nothing wrong with it at all. It's just interesting to hear the difference in the attitudes there. That's all.
Yeah.
Yeah.
It's got difference, but I think each to their own. Some people will work 6-7 days.
Yeah.
Credit to them. I don't want to do it. I don't think I'll ever do it. Like, there was part of me sometimes, I'll work 6 days a week, I'll make loads of money. And then when I started, I was like, absolutely not. I was like, when you get into that associate role, I was like, absolutely not. I need the mental space to do real things. I need to be able to enjoy life. Because I feel like throughout dental school, you don't... well, for me, I didn't really enjoy life. I was like, for me, it was getting my degree. So for me, is I want to do everything that probably students did during... I didn't travel that much because I was like, oh, what if I don't pass this exam? Like, I can't go on holiday. What if... I always sat on the edge of the stuff like that. So for me, I'm trying to enjoy life as much as possible now.
Yeah.
And spend as much time as I can with my family. And that's really important, especially my mum. And that for me is... above and beyond.
That's the priority.
Yeah,
absolutely.
that's the priority.
Now, I'm just going to finish on
Yeah.
this. I'm going to finish on this because I had this conversation with Tony
Yeah.
Kilcoyne.
Yeah.
And he said, and we're going to talk about this because Tony's coming in this later. We're going to record another podcast.
Yeah.
He said the biggest difference between your generation and the new generation, because he's a generation above me, was we see our jobs as an integral part of our life, and that is going to be an integral part of our life, and we are what we are.
Yeah.
Kind of thing. You know, work is a necessary part of life.
Yeah.
Whereas your generation is kind of, no, I have my life, I have my lifestyle, and work has to fit around that and fund it, but it's not the be all and end all.
Yeah.
Is that right?
Yeah, 100%.
Can you relate to that?
It's like you should work to live, not live to work.
Yeah.
I think that really sits with me. I was like, yeah, I work to live my life and to do what I want to do, not work, not I get up in the morning and have to go to work kind of thing.
Yeah.
It's because I want to make the money to be able to have the experiences to live in a certain way, and that's what I want to do. So if it means that I'm only working one less day a week, I can make that sacrifice to be able to do other things.
Yeah.
Just try new brunch places is one of my new things.
Oh, cool. That's nice. Nice to hear. It's interesting. Very cool. No, very good. I should learn a thing or two.
Both learned something new.
Absolutely. Well, once again, thank you so much for coming in
Thank
today.
you so much for having me.
And I'll see you at another conference very soon, huh?
Yeah. Bear in mind, me and Evan live in the same town, and you didn't even offer me a lift in today.
Well, I'm a busy guy. What can I say? I was working this morning.
That's a lie.
Thanks again. All right.
Thank you.